Reagent strips are used to perform a chemical analysis of urine. Each strip contains 10 different chemical reactions on different reagent pads that allow us to determine the sample's pH, protein, glucose, ketones, specific gravity, blood, bilirubin, urobilinogen, nitrate, and leukocyte esterase. Each chemical reaction occurs simultaneously, and each must be read at a specific time ranging from 30 seconds to 2 minutes. Each chemical reaction causes a color change, and we are able to compare the color on the reagent pad to the color squares on the reagent container. Each color on the reagent container gives us the corresponding concentration or value for that chemical reaction. In this video, we will be using the multi-stick 10SG reagent strips. The strips are contained in the reagent strip canister, and this allows the strips to remain dry and protected from sunlight, chemicals, or any ultraviolet rays. Before any patient testing is performed, quality control needs to be completed on the reagent strips to ensure they are in proper working order. Once QC has been completed and all the reactions are within allowable limits, then patient testing can be performed. The specimen requirement for this test is an uncentrifuged room temperature urine in a conical tube containing anywhere from 10 to 15 mils. The specimen is mixed before being poured into the conical tube, but if the sample sits for an extended amount of time, place a lid on the conical tube and mix the urine before testing. Prepare your timer. I prefer to use a stopwatch, but you can also set a timer for 2 minutes or watch the clock. The chemical reaction begins as soon as the reagent pads are wetted by the urine. Remove one strip, making sure not to touch any of the reagent pads with your hands, and place the strip on top of the white mat on the counter with the reaction pads facing up. Replace the lid on the reagent canister immediately to ensure the remaining strips in the canister remain protected. Inspect your strip to ensure there is no discoloration on any of the reagent pads on the strip. Hold the specimen in one hand, and with the other, pick up the reagent strip and hold it vertically with the reagent pads facing you. Dip the reagent strip into the urine, making sure all the reagent pads become immersed in the urine. Once all the reagent pads have been immersed in the urine, immediately remove the reagent strip from the sample, and as you remove the strip, gently run the edge of this reagent strip against the rim of the conical tube. Set the conical tube down, and with this now free hand, begin the timer. To prevent excess urine from cross-contaminating the reagent pads, hold the dipped reagent strip horizontally and touch the side of the strip to a paper towel or orange pad. Put a lid on your conical tube. You may set the dipped reagent strip on a paper towel with the reagent pads face up in order to put the lid back on your specimen if needed. Hold the reagent canister horizontally in one hand and the dipped reagent strip vertically in the other hand. Keep the reagent strip flat to prevent any chemicals from mixing. Do not touch the canister with the dipped reagent strip. The name of the chemical test and the time it must be read are on the far left side of the canister. The first two reagent pads, glucose and bilirubin, must be read at 30 seconds. When your timer reaches 30 seconds, move the reagent strip from one side of the canister to the other on the glucose line until you find the color on the canister that matches the color on the reagent pad. The glucose value is 500. Do the same for the bilirubin line. The amount of bilirubin here is negative, and record your answers on the worksheet. Roll the canister in your hand to ensure the line you are reading is the line facing you. Read the ketone reaction at 40 seconds. The amount here is trace, and record your answer on the worksheet. If the reaction color is in between two color squares on the canister, choose the lower concentration or value. Read the specific gravity reaction at 45 seconds, and specific gravity of this urine is 1.030, and record your answer. Be prepared. At 60 seconds, there are quite a few reactions to read. These include blood, pH, protein, urobilinogen, and nitrates. Read all your reactions and record them on your worksheet. Here we have a hemolyzed trace amount of blood. The pH value is 6.0. The amount of protein is negative. The urobilinogen value is 0.2. And we have a negative amount of nitrates. The last reaction, leukocyte esterase, is read at 2 minutes, and we need to make sure to wait the full 2 minutes for that reaction to occur before we record our answer. If we read the reaction too soon, we could report a false negative. Here, our leukocyte esterase value is negative. The chemical reactions do not stop once they begin, so we cannot go back and read any of the previous reactions once the time has passed, or we could report falsely positive or increased results. When the test is done, dispose of the dipped reagent strip into a biohazard container.